All right. So good morning. My name is Department of Emergency Medicine at VCU Health. And I will allow everyone to briefly introduce themselves on our team. If you guys just want to go around the room, we'll start with Ben, if you want to introduce yourself.
Hey, I'm Ben Del Bono. I'm an intern at VCU. Nice to meet you all.
And Sally.
Sally Santon. I'm at VCU and University of Cincinnati, emergency medicine.
Lily.
I'm Lily Daniel. I'm also a resident at VCU.
And Erin.
My name is Erin McDonough, and I'm also from the University of Cincinnati.
And then Soroba, take it away.
I'm from Sorb Candwell from Ohio State University.
Excellent. So thank you for taking the time to join us this morning. Our goal in this session is to provide guidance on how to empathetically and effectively apply the skill of breaking bad news within the realm of virtual technology. Ideally, this is something we do try and do in person. However, with the COVID pandemic, we had to rapidly adapt to the increasing use of virtual technology. This is already something that's very difficult to perform and one that is not typically routinely taught. So our hope is that this session can help provide a framework that you can use to employ in your day-to-day life as a physician, and also potentially you could use this and employ this in training sessions in your own institution. And the goal would be to help educate providers on how to apply breaking bad news using virtual media. So the plan for today is we'll have 2 cases, and for each case, we will move you all to 3 different breakout rooms. We'll have a standardized patient and a moderator in the room. We'll ask for a volunteer to act as the physician providing bad news to a standardized patient. You'll have 10 minutes to conduct the case, and at the end, the SP and the moderator will provide feedback. Then we'll go back to the main room. We'll review a didactic session on strategies to employ when breaking bad news. And then we'll move back to the breakout rooms and conduct case 2. And we'll provide feedback again. And at the very end, we'll all join back in the large group and do a large group discussion and get some feedback from you all on how you feel like the cases went. And hopefully we'll have a good talk about that afterwards. So I'll open up to any questions briefly, and then we'll get started. All right, great. I think we have everybody back now. Perfect. Okay, so I will go over a PowerPoint just giving some great background information and then some tips and pointers. Let me go ahead and share my screen. Oh, I can't share my screen. Am I able to do that? It says host disabled screen sharing.
Emily, if you could make Nina a co-host, I think that could solve the problem. I don't think you were, yeah. I think that would help.
Perfect. Thank you. Okay. All right, so this work was partially funded by an AMA Innovation Grant. So our goals are to describe the spikes model of breaking bad news, to adapt the spikes model of breaking bad news to the virtual communication environment, and to utilize this information in training sessions to practice delivering the bad news with virtual technology. So breaking bad news is a main component of what we do in our day-to-day lives as physicians. Really, we have traditionally tried to do this in person whenever possible, and we will continue to try and do this in person whenever possible. Having limitations with visitor visitation, phone and video conferencing when available more often than we'd ever used it before. So we found the opportunity to educate providers on how can we adapt the traditional ways that people have been taught to break bad news and employ that in the virtual technology environment. And importantly, we wanted to maintain empathy while doing that, because that is something hard to convey often over the phone, and less so maybe with video since you can see faces, but still there are some nuances there. So the spikes protocol is a protocol that is often well known in this literature. It was developed to deliver bad news in the oncology literature initially, but studies have demonstrated that this works in other disciplines, and studies have also shown that it has improved physicians' confidence in skills when delivering bad news, especially if you can do it in simulated environments with standardized patients. So the first part of the spikes protocol, VCU has actually adapted this so you won't find this very often in the literature unless you read a VCU paper, but I think it's a really key part of this is preparing for your encounter. In our small group, we were just discussing that and how important it is for all encounters, whether in person or virtual, to think about what you want to say before you do it. You know, we work in a really busy, stressful environment. So ensure, you know, you take that moment to collect your thoughts, sit down, take a deep breath, and ensure you're ready to be in that moment with that family, because that family and that patient, this is potentially the most important piece of information they will ever receive. And so you need to be 100% there with them. If you're not sure and you're newer and you're not sure what it is you're about to tell them, make sure that you have a good understanding about that. And that may be a good time to talk to your attending, a senior resident, and say, hey, can we sit down and review what I'm about to say to this family? And maybe even ask, can you come with me to provide me feedback and to help support me through this conversation as well? And in virtual encounters, it's really important to anticipate that your technology may fail. So have a backup device, ask for a phone number, say, hey, can we just take a moment? I'd like to have a phone number. I could call you back in case something happens. Consider doing a trial run of your audio and video just to make sure everything's working. Before you do that, call a friend and say, hey, I just want to test this out before I do this. And be sure that you're still professionally dressed, even though you're on video, it's still important to convey that. And be sure that, you ask the patient, is there any family or friends or somebody important to you that you would also like involved in this conversation? And that's important in the all encounters as well, but maybe a little easier actually in the virtual encounter. So the S for the spikes is the setting, and in all encounters, important, always introduce yourself. And it's really important, people may forget this, but always ask and go around the room and have everybody introduce themselves and what their relationship is to the patient. So you can kind of start gauging how people are related to each other and help better understand the dynamic in the room. Again, I think another important point here is just asking if there's anybody else that's not there that they would prefer to have with them to receive this news. And so for a virtual encounter, it's, I think, really key here to make sure that the person is somewhere where they can safely receive news. You want to make sure they're not driving right before you're telling them something that could potentially be very stressful for them. Ensure that you're not in a noisy environment, they're not in a noisy environment, because you want to make sure their attention's focused completely on you. One other important point is to encourage them to try and set up their camera so they're visible. I'm sure many of you have experienced the glow when people position themselves behind a window or a really bright light. So just politely saying, hey, I want to make sure that I can see you throughout this. Is there any way you could just move slightly to the left, or just move your computer so that I'm not seeing the light behind you directly? I think that's a polite way to do it, because it's really important when you're doing this to really gauge the patient's or the patient or family members' emotions, and you can do that by looking at their face. So the P is perception, and in all encounters, it's really important to ask them what they understand about the current situation, because that actually drives where you're going to go with this conversation. So somebody that has no clue that their family member was even admitted to the hospital is very different than starting out by saying, what do you understand about what's going on with your loved one? And they're saying, oh, I know they've been in the hospital and I know they've been intubated and they've been, that drives your conversation from the start in a very different direction. So it's really important to understand where they're at mentally and where they're at with their knowledge base before you really begin giving them information. And in virtual encounters, realize, in these situations, they may know a lot less than they would have known being able to come in and visit the patient more often in the hospital. So they may know nothing, whereas at least before, when they came in with the patient, they've actually seen some things happen and have a different place and time. So just be empathetic to that and be ready to maybe explain a little bit more than you would normally have to. The I in the spikes is immediate concerns, or what we say invitation. So for all encounters, it allows you, it's important to inquire as to their readiness for the conversation. And this means, hey, I have some information I'd like to share with you, and this may be a diagnosis that you guys have been working on for a while, and you've just discovered something on a CT scan that the patient's been waiting to get, and you did it in the ED. So something that, I have the CT scan results. Is this a good time for you to hear this information? Are you comfortable with me, discussing this with you now? Or would you prefer to have your primary care doctor talk to you about this information? Just make sure the patient is ready to hear what you have to say. And also make sure to address any concerns that the patient or family member may have. But for virtual encounters, again, make sure, it's really often hard to appreciate emotions, particularly over the phone. Again, like I mentioned, it's a little bit easier maybe with video because you can see their facial expressions. But regardless, I think just importantly, you're asking them to, in the similar way as you would in all encounters, but you're often having to ask more often than you normally would, I think, in person, to say, tell me how you're feeling, or how much of this would you like me to talk about today? I think you kind of have to pull some more information out of them sometimes when you do this over the phone, just because you can't see them in person. So you want to really gauge where they're at so you can address their emotions and provide comfort or provide more information that they may need to better understand what's going on. The K is knowledge. So for all encounters, it's important to be very clear with your information, very concise and very unambiguous. Avoid vague statements, avoid medical terminology at all times if possible. One example I like to use is when somebody has died, I think it's very important to use that word. Your loved one has died. It's important to realize you want to avoid statements as passed on or expired or is no longer with us, because that can be interpreted in a lot of different ways. So be just very clear in what you're trying to say. And then when virtual encounters, body language, I think, is very important. And so often, I know you guys have been in plenty of Zoom meetings where the screen does freeze and you're confused for a minute, and then you can't hear anything. So kind of make sure you're moving a little bit so that no one assumes that the screen is frozen, especially when you're allowing, we're about to talk about, when you allow for silence, you may have delivered bad news, and the receiver may be just sitting still for a moment because they're not sure, they're upset, they aren't taking the information in. So be sure that you yourself are moving a little bit so they know you're still there and you're still in the moment and that everything's working. The E is for empathy, and for all encounters, I think it's really important to acknowledge and allow for emotions. So in virtual encounters, I alluded to, allow for silence after you deliver bad news always, but in these situations, again, move slightly so that they don't think that the screen's frozen and you're gone. Make sure that they know that you're still present. One other thing you can try and do is maybe lean a little closer to the camera. It seems to convey that you have a little bit more empathy, that you're trying to get closer to them in this moment, where normally in person you may touch them on the shoulder at that point in time. That's kind of a substitute what you can use in this situation. And I'll try and say things like, how are you feeling right now? And, if I was with you right now, I would offer you a tissue. Please take a moment. If you need a moment to yourself, I will be right here waiting. If you need a moment to go grab a tissue, I'll be right here waiting for you. Just using phrases to convey that empathy that you would normally usually provide with physical touch. Any questions? All right.
I think that was phenomenal. One of the things that I really like, especially toward the beginning, is that free association that takes place. Tell me what you know so far about your condition or what happened. I think allowing them as much time as they need to tell you, I'm always amazed at how healing that can be, just letting them kind of speak for however long it takes. I try not to interrupt them until they've told me how much they know. So I really like that part of it.
Absolutely. Thank you. All right. So we can go back into the breakout rooms, or since we actually had Nathan help us, and he thought he was just working today, but he graciously volunteered to do our case for us in our breakout room. If you guys don't have anybody else that you've broken out into, do you think we should just stay? We can just stay in the big room, and we can all listen and all kind of gain some experience with that. We have one more case we were going to do. Nathan, I don't want to put you on the spot, but if you'd like to do another case now, we would love to have you do it.
I think my limit is in front of a full group of people. I think I would love
Yeah.
to watch Dr. Gil Salazar. I know he was in our group. He had a lot of really good thoughts, so I would love to see how he does it as well, personally.
Okay, that's a great idea. That's fair. Are you okay with that, Dr. Salazar?
I am.
Okay.
I understand I just put you on the spot after being put on the spot, so I'm sorry about
That's
that.
okay. It's one of those things I'm very, very passionate about. If I might mention something where we do the exercise, is one of the particular challenges is when you have a non-English speaking patient and you have to do this virtually. The transition between interpreter and clinician and patient can be kind of tough. So just kind of bear that in mind and allow plenty of time for the interpreter to have time to explain things before moving on.
Okay, great. Lily or Ben, do one of you want to volunteer to be the standardized patient?
Yeah, I can do it.
Okay. All right, I posted, Dr. Salazar, I posted the case in the chat for you. So take your time, and then when you're ready, you guys can get started.
All right. All right, Ben. So you'll be the oldest child on the phone waiting for an update.
Yeah.
Okay. I'm ready, my friend.
Okay. Hi, can I please connect with one of the physicians taking care of my mom?
Hi there. This is Dr. Salazar. Good morning. Who am I speaking with?
Hey, nice to meet you. I'm Ben. I'm the oldest child of the woman that you're taking care of.
Okay, that would be Miss Smith, correct?
That's correct. Yeah. Is she okay? What's going on?
Ben, let's talk a little bit about what's happening. Let me ask you a quick question. Are you in that place right now where we can chat for a second? Are you driving? Are you sitting down, etc.?
Thanks for asking. Yeah, I'm actually at home. Yeah, I think things are fine. I'm at home, just on my computer.
Okay. And the second thing, is there anybody else that would like to participate in the conversation? Any of their family members with you?
There's nobody here right now, but I appreciate you asking.
You're very welcome. My name is Gil Salazar. I'm one of the emergency physicians here at the hospital taking care of your mom. Tell me what you know so far, Ben.
I mean, I don't like, I saw her yesterday and I haven't talked to her since. And then, I got a text message from my brother that said that she was in some sort of accident or something. And I think I missed a call from the hospital. So I don't really know what's going on, to be honest.
Okay, Ben, no problem. Let me fill you in. I can tell you that EMS brought your mom. She was involved in a crash out there on the freeway. They brought her in. By the time I arrived, Ben, her condition was not good at the time. She had some major injuries. And she was in pretty grave condition, and even her heart wasn't beating. My team and I got to work really quickly.
Like her heart wasn't beating, like she like what do you mean?
Yeah, her heart wasn't beating at the time. It wasn't providing any blood to her brain and any other parts. So we got to work really quickly with the team to try to resuscitate your mom. So we were giving her oxygen through a breathing tube. We were doing some CPR on her heart, giving her some blood, and trying to do some tests.
Is she
And
okay? I mean, like how, like what happened?
then after probably about 25 minutes of trying to work, your mom was such a grave condition that we didn't think that that she was going to make it, and we made the decision to stop the resuscitation at that point. And I'm sorry to tell you that she died.
Oh, did she suffer? Like who was with her when she died?
My team and I, we were with her the entire time. And in my humble opinion, I don't think she suffered at all. We did our very best to try to resuscitate her. But I can reassure you that my team and I worked really hard to make sure that we had the best possible chance. But that didn't come through, and I just wanted to let you know that we're going to be here for you. I have a chaplain here with me, and I wanted to see if you had any questions at this time. I wanted to, if you want to take a minute, kind of think about it or talk to your family members. I'm going to stick around here as long as we need to.
And I mean, thank you for all that you guys did and for being honest with what happened. Yeah, like what I don't know. Like I've never had anybody this close to me die before. So like what do I do now? Like what are the next steps? You said
Yeah,
there's a chaplain.
yeah, we definitely understand this is going to be a tough time, so we're not going to leave you hanging. So here's a plan of action for you. Here's a chaplain that's going to go through a couple of things with you, give you some information about how to get to the hospital, etc. And going to give you some information on how to, if you want to come and speak to me personally, I can make myself available in person, and you can bring some family members. We can kind of go through what happened and even allow you to see your mom if you would like.
That would be very helpful. Like, thank you.
All right.
Good. Great job. How do you think that went, Dr. Salazar?
Always pretty tough. You know, I'm a pretty seasoned clinician, 11 years in emergency medicine, and the humanism of it should never go away. It's always tough. This is somebody's family member. Some situations hit harder than others. It's especially tough when it's kind of younger family members. You know, sometimes when you have patients who have died who are older, perhaps it was expected. I think the hit is a lot softer for both family and clinician, but sometimes when it's this unexpected, it never hits to hit hard. So I try to remind myself that it is okay to be human. It is perfectly okay to um, get teary-eyed. Sometimes it's okay to silence is perfectly okay. And one piece of advice I have for everyone, especially toward the end, I like to make sure that there's a game plan, action, a social worker, a chaplain, so that they don't feel like you just kind of left them out to dry. So Ben, you did a really good job being as the patient's family member.
Yeah, thanks. I like that you took those steps in the beginning to ask if I was like in a quiet place and all that. I'm sure it's like easy to forget that in the heat of the moment when you know you're about to deliver like such difficult news, but it's so important.
For sure.
Yeah, I agree with you too. I think it's really important to have that kind of, it also gives you an out in a way too. It's that closing kind of, after at the end of it, what we have other resources that are available for you. And you did the exact right thing. Like, I want to leave you, to process this, and we'll be right here. But I think that's the perfect kind of the out to provide the resources. Say, we want to leave you with you and your family to go over this. I know it's a lot of information, but and importantly saying, we're here to support you through it as well.
I also just want to say I really liked how you started it. When you first started talking, the way you addressed, where are you? Are you in a safe place? Is there anyone else that should be included on this? Just the way you did it was so natural. And I feel, as someone who has very little experience with this, I feel it can be hard to go into it without, because sometimes you can hear if something's wrong in someone's voice and stuff like that. But the way you conveyed it was very professional. You were making sure they were safe and everything before you started bringing in the news and all that. I thought that was awesome.
Thank you. You'll be practicing pretty soon. I take all my residents to every notification, and once they feel comfortable with it, they have at it, and I'm a fly in the wall, helping out as needed.
Yeah, Nathan, we talked about that a little bit in your session too. I think that's really important as you're starting out, as Dr. Salazar just mentioned, like, make sure before you go in there, you definitely want to try and start watching these as many, because you'll pick up ways people do things and ways people don't do certain things that you may want to do. But always, no matter what, just thinking about what you want to say before you go in there, and always saying, hey, can someone please come with me? Especially if you're starting to do it yourself, just to at least sit there and give you feedback when you guys step out of the room. Like, can you tell me how I could have done that better, or what you thought? I think that's really important until you're a more seasoned resident and you're doing this on your own.
I think another thing I was thinking about, just to add, is it's so good to have a game plan. I totally agree with that. But another equally important thing I think is to be flexible, because every notification is different. You can never anticipate the grief reaction. Sometimes it's anger, sometimes it's disbelief, sometimes it's extreme sadness, sometimes it's nothing. So just reminding yourself that there's a human in front of you, and you can have a game plan all day long. And at the end of the day, really, you have to just be flexible and kind of be what they need in that moment. And of course, then allowing yourself to process afterwards, and give yourself those 2 minutes that you need to just kind of recompose yourself before you go back, and you obviously are going to have more patience. So.
And I totally agree with Dr. Salazar. Like, even after doing this for over a decade, these never really feel easy. Exactly. You get better at them for sure with practice, but they never feel easy.
And I like what Lily just mentioned too. Lily and I actually had a pretty difficult encounter not too long ago together, where we had to tell
PTSD from.
it was a tough one, and we were both there together, actually. So what she said too is like, exactly, every encounter is different, how the reaction is perceived. And I think what was important for us in that encounter was debriefing as a group. We took the nurse in there with us, we had the chaplain in there, we had social work, and it was all of us really felt the sting of that one. And so debriefing kind of as a group afterwards, to talk about it together, I think is really important too, because it allows everyone to kind of give their perspective and helps you work through it. Well, thank you all so much. Does anybody have any other last thoughts or?
I just want to thank you guys for letting me contribute with this. This is awesome. I really enjoy this aspect of medicine, the human connection, and to be able to actually, try this and listen to you guys, and Dr. Gil Salazar, listening to you do one. It was a really good learning experience. So thank you guys.
Thank you, Nathan, for participating too. Glad you got something out of it today.
Of course.
Well, thank you all very much.
Thanks, guys.
Bye.
Thank you. Cheers.
Thanks, everyone.
Take care.